Welcome back. Now, taking too much of a medicine is known as an overdose. General Practitioner Dr. Sylvi Kapundja is joining us this morning to talk to us about these dangers. Good morning, Doc, and welcome back to Good Morning Namibia.
Thank you so much. Good morning to you too.
We are eternally indebted to you and grateful for your continued service, altruistically and generously to the Namibian nation.
Thank you so much, Deva, and you guys are welcome. I enjoy it.
We're happy to hear that. We're happy to hear it. Doc, now, let's talk about what an overdose actually is. We do know that on the prescribed dosage, you hear maximum of a tablespoon of the cough medication per day, but some of us may feel pressed because we want to get rid of the summer flu and take 2 tablespoons. So what constitutes an actual overdose in medical terms?
Okay, so an overdose is when a patient takes excessive medicine to what is prescribed or recommended, both accidentally and intentionally. So that is what we constitute as an overdose. These can be medications that are prescribed medication, over-the-counter medication, illicit drugs, and also alcohol, any substance.
Very well. So why is it a concern to take more than what is prescribed and or recommended?
It's a concern and a complete red flag if you do so, more so when it's intentional, because intentional one, for different reasons, maybe as you said, the flu has been overwhelming and you wanted to get it over and done with. However, what it does to the body is that your body can only use up a certain or a specific amount of whatever you're taking. However, when you take it in excess, the rest of it lingers in the body and your organs get, intoxicated, and it becomes toxic to your body and their cells, and then it can have side effects to your body, both, fatal, life-threatening, and also non-fatal. But, worst case scenario is that it can be fatal.
That is, of course, quite serious. Could it also result in long-term organ damage?
100%, Denver. So a lot of patients actually, or some patients rather, they can take, let's say, the most common medication, paracetamol or Panado, the brand name. And they'll say, no, I just took, 5 Panados in a span of 5 minutes, 20 minutes, because they wanted to work immediately. Yeah. And prolonged use of that, or if your body cannot take an excessive dose and, filter out the rest and try to restore itself to baseline, it can complicate in such a way that, for example, you end up having an acute kidney injury, which is like, your urine output and how your kidneys functions can be affected, and this can be permanent, or if you're lucky, we can reverse it. And this can result also, in liver damage and all these things, acute or chronic, or right now, or you can last with it for years even, or sometimes we cannot do anything about it anymore. And the worst case is for it to affect your brain.
Sure.
Yeah, it can
How
affect
does
your
it
brain.
manifest? How does it present in a patient whose brain has been affected by long-term overuse?
So usually, starting off with like the acute onsets, you have things like you have blurred vision, you have dizziness, you feel a bit faint and weak and all these things. And then when it's really, really bad, and especially in patients who take it intentionally, like for reasons like ending their lives and so forth, they end up in the ICU, and sometimes your brain becomes deprived of the oxygen and the nutrients that you are supposed to be getting, and this can have long-term complications, which you can become a vegetable, sorry for a lack of a better word, but you can completely lose your cognition, decision making, you can become wheelchair bound. It's horrible.
Sure.
Yeah.
I've heard it, and I'm sure you may have heard it as well. Some people saying, I can't function unless I've had my grandpa, whether there's a headache or not, whether there's any other presentation of any symptom. And the auntie is 70 years old, and she's been doing so for the past 50 years. And because she's been able to get away with it, she continues with it. What would you say under those circumstances?
That term, that white powder, I don't think I'm allowed to say the name, but that white powder is a recipe for disaster. It's a recipe for disaster, and I'm glad that it's not as readily available
anymore
as it used to be anymore. Thank goodness, because I think the healthcare workers, you know, it has horrible complications because not only can it be toxic when it's taken, you know, in a substantial amount. However, it also has other side effects like bleeding and all these things. That
even in moderation.
Yes.
Because some people would travel to
even
countries where it's still readily available and bring sufficient stock with to share with their cousins and their sisters. That's what I've learned they do. I don't do it.
Denver, are you not guilty?
I don't do it. Yeah, I've also not done it.
Okay, I'm glad you have not done it because it's really a bad thing. And even if you're not taking it like in overdose amounts, it has a long-term complication that is horrible. It can cause, you know, GI bleeding and all these things, and even worse so when it's taken in an excessive amount, it can complicate. The bleeding will be severe, we'll be unable to stop it.
Don't take the white powder.
And please, just don't take the white powder.
Yeah.
Drink water and take paracetamol.
And rest.
And rest. And sleep.
Yeah. Doctor, in the event that a patient presents to you having overdosed with whatever, what is it that you do in terms of the initial intervention?
Okay, so the initial intervention, firstly, we have to take the history in the sense that what did the patient take, how much did they take it, where did they take it, and why? Was it accidental or intentional?
And you need transparency and honesty.
100%. We need transparency and honesty because we need to know what, was it an intent, like, you know, were you trying to do something, you know, end your life, are there social problems, or it was a mere accidental, you know, oh, I thought I had to take 20 mils of cough syrup, but, you know, and all these things. So we take that, and once we have that, we then go into the physical management of the patient. And the first thing we do it's like all emergencies. So an overdose is a medical emergency. So we like to stabilize the patient, take all the vitals, do our ABC protocol for emergency care, and then we also administer medications that will basically bind to whatever that you've taken so the body does not absorb it. So I'm sure we've all heard of activated charcoal. So that black powder is in discams and things. So I always tell my patients that that's a good medicine to have in your medical cabinet at home because you can give them like a spoonful diluted in water and they quickly drink it. So those black particles of the charcoal attach to the medication, and then the body will not absorb the medications anymore. So you either vomit it out or you pass it out from behind, and that's what exactly we do. And after that, we usually now stabilize the patient depending on how they're doing, what's their blood pressure, how's their heart rate, how's their breathing. Then we can supplement with oxygen if their breathing is compromised and all those things. And then obviously we have to monitor them. So most overdoses, if not all, they are all admitted because we do need to observe you for at least 24 hours. If
someone is tuned in at the present moment, ready to take their daily dose of the white powder and realizing that they may have a problem, what is it that they can do to get rid of the challenge? So as all medications or as all substances are concerned, when you're used to taking, a substance, it's either you become addicted to it, or you can't function, you can't do anything without it, or you become dependent on it. Not necessarily you having the cravings, but you feel like, no, as you said, I can't function without the white powder and things like that. So the first thing is do your research. Especially the young generation, we have access to resources. We don't need to listen to tales anymore. Do your research, do your homework, educate yourself so you know what the dangers are, what you can do to minimize the risk of certain complications, and if you're having trouble, stopping yourself and informing yourself that no, and accepting the fact that what you're doing to yourself is not good. Visit a healthcare professional so they guide you through and they can give you a safer alternative to whatever you're already taking. Any final thoughts before we let you go, Doc? Yes, you just reminded me. So there are patients who have chronic medications like blood pressure and all this, pain and all these things. One thing I've seen, and I've even seen it over this weekend when I was on call in one of the hospitals, is that patients tend to share, they self-medicate.
even with hypertensive medications. You know, I had a patient who had syncope, they fainted because, you know, their blood pressure was very low, and the mom gave the patient a blood pressure medication thinking she's going to help. So in most cases, when it's prescribed medication, it's just for you. It's just for you, so please don't give it to the next person because it might do more harm than good. So please, let's be aware and rather not. Call your local pharmacy, always ask, call your local doctor, even if it's not for a consultation. We can always telephonically advise you at no cost at all.
Thank you, Doc. Thank you so much. We appreciate you.
Thank you so much, Denver, for always having me.
General Practitioner Dr. Sylvi Kapundja talking to us about the danger of intentionally or accidentally overdosing on any substance. We will be right back after a brief break.